Hello, Medicare Advantage Risk Adjustment operators, innovators, and learners. Welcome to the last week of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind for this month. We are glad that you are able to join us today. If today is your first time that you are joining us, we want to say welcome. If you have been a seasoned learner with us, we also want to say welcome. Thank you for spending the time with us as we learn together in this space. This month, we've been covering 4 Medicare Advantage risk adjustment stakeholders that you need to know. And if this is your first time joining us, then I would recommend you to watch the previous ones that we have covered over this month. If you are new to the channel and have not subscribed, we will encourage you to subscribe to it because it helps us to reach a wider audience. I am your host tutor, Dr. Prince Bewa. Today we are looking at the U.S. Department of Health and Human Services Office of the Inspector General, where you'll hear the acronym, the OIG. The Office of Inspector General, the OIG for the Health and Human Services, is an independent oversight agency that was established in 1976. And OIG was established to promote economy, efficiency, effectiveness, and integrity within the HHS program and the health and the welfare of the people that the HHS programs serve. The OIG oversees the $2 trillion HHS programs. And in this space where Medicare Advantage is part of it, because the Centers for Medicare and Medicaid Services fall under the Health and Human Services. And they have a dual reporting to both the HHS and also to Congress. The OIG structured in several offices, and you can see the list from here. There's the Office of Audit Services that conduct audits on HHS programs and grantees, the Office of Evaluation and Inspections, which does national evaluations on major issues, and you will see that in the resources that OIG produces in the Medicare Advantage space. There is the Office of Investigations that investigates fraud, waste, and abuse. There's the Office of the Counsel of the OIG, which provides legal support, compliance guidance, and also enforcement actions. And the Mission Support Infrastructure that provides the strategic planning, HR financing, and other activities that the OIG depends on to do their work. The OIG has a staff of over 1,500 dedicated to systematic improvement and program integrity. And their expertise, based on the work that they do, ranges across several disciplines as auditors, investigators, evaluators, legal, technology, cybersecurity, data analytics, statistics, medicine and policy, economics, management, and administration. OIG's work in the Medicare Advantage risk adjustment space is very common. And if you work in Medicare Advantage risk adjustment, you will see OIG reports all the time. If you're new to this, be ready because you will see a lot of talk about the OIG. There are several resources that the OIG produces pertaining to fraud, waste, and abuse and audit. For example, in the Medicare Advantage space, you will see compliance audits on diagnoses that are used for risk adjustment payments, which there have been a lot of reports. The OIG has several reports on chart reviews and health risk assessment, and also for denials, prior authorization. These are beyond MA risk adjustment, but they all fall within Medicare Advantage, which falls within the CMS's purview. OIG also produces some toolkits. For example, based on their work on Medicare Advantage risk adjustment, OIG developed a toolkit to help the industry to use to leverage to decrease improper payment in Medicare Advantage risk adjustment through the identification of high risk diagnoses. So OIG, apart from doing the audits, also provides some resources that the industry can leverage as they make sure that the programs are running as they should. And with that, we will take some time and go to the OIG website. When you get to the OIG website, which is www.oig.hhs.gov, their landing page has information about what OIG is. And if you navigate to the OIG website, you will see the various mission, vision, and values of OIG. And you can actually look at the OIG leaders. There are downloadable resources. There's the opioid toolkit. There's a behavioral health, medication, and opioid use disorder. And one place that I will go will be reports. And you get to the reports and you can explore all the reports here. And in our case, we are looking at CMS. So you can definitely look at CMS for risk adjustment work. We can look at audits, and we can get to part C and do apply. And now you can see several resources. That's what I talked about here. There's a Medicare Advantage compliance audit of specific diagnosis codes that UCare Minnesota and the contract number submitted to CMS. Usually the reports come with a highlight that gives a very quick read into it. And then you can have the full report here. You can leverage these reports as you work in Medicare Advantage Risk Adjustment Program. I hope this quick review of the OIG website was very helpful to you. If you are new to our channel and you have not subscribed to our email list yet, I will encourage you to subscribe, and you get the chance to have this gift. It is From Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources. And it compares the various Medicare Advantage risk adjustment data sources in a very simple way for you for free. If this has been helpful to you, I will encourage you to subscribe, to like, to share. I will see you next month as we begin another series. Bye for now.